Hello, I'm Kathy Chester, and this is Move It or Lose It, a podcast about all things that move the mind, body, spirit, and soul.
Hello, welcome to another edition of Move It or Lose It. And today I am honored to have Dr. Gaskill. I just messed it up again. Dr. Aviva Gaskill. And she is a clinical psychologist and is graduate of the School of Psychology at Furkhoff, right? At the University Health Clinical Psychology and Health Emphasis at the University of Furkhoff. And you're also licensed as a clinical psychologist in the States, right? In Pennsylvania and New York?
I'm in Pennsylvania and New York. And then I am a member of something called PsyPact, which is a program that allows me to practice in about half the states.
Yes. I want to talk about that too, because I talked about that when I had Megan Byer on, because Michigan, unfortunately, it's driving me crazy. I'm like, come on. So explain, if you will, again, what that means for those of us who don't have, and again, when I introduce you, the point of Happy MS Awareness Month of March is wanting to have you on to explain to a lot of our MSers that I didn't know until a couple of years ago, that there are people out there, psychologists out there that understand and have studied what we go through on a daily basis and how our emotions and how, from sexual issues to depression, how you understand that in a much different way. And so if you don't mind, explain to me how you got involved in that and how exactly you help with us.
Yeah, so I got into graduate school and decided to go to the Fairclough Graduate School of Psychology. It's part of Yeshiva University in New York. And I just loved the idea of like the convergence of, more traditional medical aspects and learning about different conditions and how they affect people's bodies,
Right.
and how that can overlap with psychology. And that just seemed so exciting to me. So in my practice, I have a practice, and we get to work with people who mainly the people that we work with are people with chronic or terminal health conditions.
Right.
And we work, we talk to them about, living with depression or anxiety and just different mood states and how they different aspects of what they're living with. And a lot of it is, I think, like you said, right, you've never heard of health.
Right.
Something that most people have not heard of before they
For
call.
sure.
And, they get this opportunity to speak with someone. And like you said, sometimes they've been to a traditional therapist before.
Sure.
To speak with someone who goes, oh, you get that I can't.
Right.
Or you don't treat me like my other doctor.
For sure. Like I was talking before we pushed play, to Dr. Gaskill about how it's so different. And I've been to different psychologists, especially the last couple of years with COVID. And when I found out my MS was getting a little bit worse, and I own my own business, so there was just a lot. And my MS, it was just the anxiety was here, and I couldn't ever get them to really understand what it was that I was going through that felt different and why the anxiety would hit it. There just wasn't that. So I guess the closest I came was going to visit some different neurologists, and going to Cleveland Clinic was the closest that I came to, oh, there's a team of doctors that understand what I have. And so there was, a psychologist there, and that worked with MS client. And it was just like, wow, she knows, she understands it, she gets it. So I think, like, just what you're saying is that for so many of us that are trying to explain, there's different things that go on in our bodies and mentally for us that,
yeah. And also we're not going to try and, any therapist who understands, different medical conditions. And mostly the people that I see live with either chronic pain or chronic fatigue.
Right.
But anyone who understands that is not going to say, oh, well, you're just depressed, so that's why blah, blah, blah.
Right. Right.
Or you're anxious, so that's why this is
Right.
happening. And so
Right.
we have a tendency to understand and say, that doesn't quite sound right to me. Why don't you talk to your doctor? And sometimes
Right.
then we'll try and help my patients, have some of the language about how to speak to their doctors, right?
Yes.
For example, one of the things that happens for a lot of people living with MS or other neurological conditions is they might have something like slowed processing speed.
Right. For sure.
And they
The
don't,
cognitive issues that.
it's like you don't know how to have the language for that.
Right.
Someone who's a professional might explain to you, here are the words to use
Right.
to explain to your doctor what you are experiencing.
Right.
And it's really hard when you don't have the language.
For sure. Yeah, definitely. There was a long time during that period that no one has ever accused me of having a lack of words, but during that time that I just didn't know how to express. So I absolutely understand. And one of the things that I love that you do is working with Parkinson's, multiple sclerosis, but insomnia, which in so many of our autoimmune world, I mean, gosh, I had a terrible night last night in trying to sleep, and that's not uncommon. I mean, there's usually at least 3 to 4 nights a week that my sleeping is really wonky. And I think there's so many of us, and we get pushed from medication to medication and different things that'll help. And then it adds on to all these other issues.
Mm-hmm.
And so I think that's something that today's will be a little bit shorter, and then we're going to go on to have you on again for sure. But a couple of things I wanted to talk to you about. Talk to me about some of the I heard you on Find Empathy, and I love some of the things that you talked about. So we know that depression is really big in multiple sclerosis. Why do you think more so in multiple sclerosis than some of the other autoimmune diseases?
So what's interesting about in multiple sclerosis is that the depression in and of itself is a symptom of MS. That's
Right.
not necessarily true for other conditions.
Right.
It may come up as a result of living with those conditions or just everyday life.
Right.
In multiple sclerosis, it's understood that some of the changes in the brain actually,
Right.
in and of themselves create the symptom of depression.
Right.
And so that's one thing that is different.
Very.
And why it may come up much more often
Mhm.
than it may, come up in other conditions.
Right. Do you find that different medications, different DMTs have to do with that, or no?
Definitely anytime anyone is on a neurological medication, whether it is for seizures or multiple sclerosis or anything,
Right.
it's going to change your brain chemistry.
Sure.
And, right. It affects it, I should say. And so that doesn't mean it can't necessarily go back to baseline. For some
Right.
some things it can. But yeah, I mean, it changes the way a lot of the neurotransmitters are processed through the brain.
Right.
It's going to affect depression.
Right.
What seems like it happens for folks with MS is that actually like the meds tend to really help, with depression. And then, also like the, some of the meds, if you take an antidepressant, it can actually really, really improve.
Right.
That's, that.
Do you find that, because I know that I've talked to some of the psychologists and a lot of the clients that I do all movement and training. So a lot of my clients, I notice the anxiety is higher than the depression. So the anxiety takes place, that starts up like, can I get this done? Can I finish this? I'm supposed to do this at this time. All the cognitive stuff then sets in, then the stress. And I've always believed that the anxiousness comes first, and then the depression of, oh, I didn't finish that on time. I didn't do this the way I wanted to do it. And I can't complete anything. And that kind of leads into the depression.
Well, so everyone's different. Again, depression in and of itself is a symptom of MS. So
Right.
For people, you only see depression, some people only anxiety, some people both. I think that's the thing about it. It's sort of this thing that kind of comes in and out where they weave together and they kind of create a mess, just like any kind of stress.
Right.
And create more and more stress.
Absolutely.
But I think, the thing in terms of anxiety is, I think one of the things that comes up for a lot of people living with MS, and a lot of other, again, conditions where you're not able to function at the pace of life.
Right.
And maybe to the degree and the thoroughness maybe that you would have before.
Sure.
So, for someone who maybe has, let's say, a more perfectionistic personality, they don't. They're going to feel incredibly frustrated that they can't keep up with, what they used to keep up with, the same pace before,
Yeah.
Something that, takes, 10 times longer because you have to read paragraphs, especially if it's legal or really important.
Oh gosh, yeah.
You want to read it a lot and really thoroughly understand what you're doing. And that just takes so much longer than it did before.
Oh yeah. And then I think if you agree with asking for help, like learning to get to that place where, for me cognitively, and I'm getting ready for things, and maybe cognitively it's not setting like, oh, how do I get this on right now? And I've had a, not slept so good the night before. And I think being able to go to someone and ask for help is, someone like you, but someone that's on our team in our caregiving place. Hopefully we have someone that we can ask for that. And just kind of calm things down. But I do love, what would you say? So I'm going to ask you for tools for both of these things, but the two things I want to tackle today are not just the depression and the anxiety portion, but I did an interview with a group of men, and I did an interview with a group of women, and it was all on multiple sclerosis and sexual dysfunction and the depression on that. And so the guys were incredibly open with me about how they felt about through the age. Some of them were younger guys, 19, 20, 21. And the struggle was just, feeling like their manhood was taken away, obviously, having the inability, having sexual dysfunction. So I was very grateful that they were able to talk about how it made them feel younger, but also when they were older, the older guys were able to say, sometimes it's okay just to be intimate in bed and hold each other and be undressed and things like that. And the women were, I found to be, it was more difficult because there hasn't been a lot of talk about that through the years. So I would say, even having it so many years, I never understood like the numbing issues and things like that until much later, until now. We talked about that, and we talked about ways with your significant other that you can work through that. So how do you help patients with MS deal with those big issues?
Well, I think it's actually not so dissimilar to something like word finding, right? So the main thing is, first of all, obviously there's medication, and you always want to talk to your doctor. Is this something that is actually being caused by my MS, potentially, or related to it? Or is this something that's not? Because lots of people, and let me be very careful in saying, women and men throughout their lives can experience challenges with sexual dysfunction. We do not talk about it nearly enough. So men, whether or not they are living with any kind of neurological condition, any other kind of major medical condition or not, do not talk about living with sexual dysfunction. And it is way, way more common. A lot of, at least from what I speak with, like cisgendered men will say to me, oh, I thought that was something that would happen when I was older. And I'm like, no, it can happen in your 30s.
Yeah.
Like, again, even without any major medical diagnosis. So
correct.
That's something important for everyone to know. Obviously, for women, our bodies change a lot more throughout our lives, with menstruation and menopause and all of those, and more significant hormone fluctuations. That obviously can affect things. So it's important to understand as best you can, is this just sort of, my body doing its thing? Or again, is there something that maybe is being affected here by my multiple sclerosis? But number one, again, what I was saying before is word finding, same thing, right? So you actually just want to calm down. The more anxious you are about any issue, again, slowed processing speed, word finding, sexual dysfunction,
Right.
the harder it's going to be to make it
Right.
work,
Right.
So, I think the thing is about being able to slow your body down,
Right.
slow your mind down, try and enjoy, like you said, whatever aspect of
Right.
or being with your partner that you can enjoy, that
Right.
any kind of loving touches,
Right.
like you said, lying there nude together and just
Right.
cuddling. If you maybe can't sort of have an orgasm yourself, but
Right.
your partner can, maybe you can help your partner to have an
Right.
orgasm and get
Well, funny that you would say that, because the women were so hilarious. They had at the bottom of the show notes every toy available to help them, where the guys didn't really go there. But the girls were like, oh, I use this. This is great. This one's great. So the girls had a much more, I feel definitely more with our younger generation, a much more ability to say, no, this is what I need.
Yeah.
I need this too. And which delights me that they're able to be vocal
And
more often.
Right? Like that's
Right. I was like, wow, that's awesome. So, I mean, for them to feel bold enough to say, no, like I need this too. And these are the things that help me.
Yeah.
And I just found that to be
normal for women not living with MS.
right. Right.
So I think that's so important. And again, really being able to talk about it. I think one of the main things is that I hear a lot of neurologists say, I know my patients deal with this and they don't come and talk to me. Well,
Right.
it goes both ways, right? The neurologists need to be a little bit better about asking.
Right.
And patients need to be able to, go and talk to their
Right.
doctors about it. And I know that that's hard.
It is. It's awkward having a male neurologist that we haven't always connected well with. So it's like, I don't think I would ask him anything, maybe who he recommended for a urologist, but other than that, I would feel very odd talking to him about my sexual stuff.
But then could you maybe speak to your gynecologist who also knows you live with MS or something like that, right? So
yeah,
those are the kinds of things like, can we work around? Can we
right.
Can we find a health psychologist?
Right. That's what I think there needs to be a way. And I know you're able to practice. So explain again what that program is. Okay. So let's say I'm in Michigan. I know we're not set up for that yet. I'm like, come on, we're almost there. And let's say I want to see you. Let's say I decide, oh my gosh, I'm watching this, I'm listening to this podcast, and I say, I'm hitting some needs. I know today we're tackling sexual issues, and we're tackling depression and anxiety. But one of those topics, really hit them and they want to get a hold of you. How is that done?
Yeah. So I'll explain what PsyPact is, and then I will tell you a little bit about how to reach me. So PsyPact is an interstate program that is available only for psychologists. Not every psychologist who is able to be in the program is in the program. You have to sort of register. It's sort of like a bonus to your license, like an added thing that you
right.
before. And I have to renew it every year.
Okay.
It allows me to practice in, I believe now it's 27 of the states in the US. And again, I'm also licensed in New York, which is not part of
right.
that. So, as a psychologist who lives in one of the PsyPact states, I have, I'm part of the program, and I'm able to then see patients in a bunch of other states and practice.
Sure.
That being said, right now I'm full. I have a group practice, and I'm the only one in PsyPact. I'm hiring someone else, so we'll see.
Oh, great. Great.
Can be part of PsyPact, but it's a wonderful program. And again, I know there are not enough health psychologists or therapists out there who understand health issues.
Correct.
So, I know it's helpful to have access to people who do understand these things. So if people want to get a hold of me, they can reach me or anyone on my team. They can reach us through the website, which is avivagaskill.com.
Mm-hmm. And that'll be at the bottom of the show notes as well.
Yeah, so it's AVIVAGSKILL.com.
Okay, perfect. And then, so let's say that they are in one of the states that they can do this. And so they learn now that they can call. And do you see this growing, that more psychologists are going to be a part of this program?
Yeah, I think so. I think more and more psychologists will be in the program. I believe word on the street is that social workers are going to be starting to have
Okay.
too. So that would be amazing if
Yes.
workers can also join, and then it'll probably expand to licensed family therapists and licensed marriage and family therapists, and also
Right.
PCs. So
Yes.
we'll see, how it goes, but it seems to be working really well so far.
Yeah. I'm very excited. I think just to give, during the month of March, just to give our MS and our chronic illness patients aware that there are psychologists that are out there for us that understand what it is that we're going through. And if we're not getting that need met by, and I have had plenty of clients had their need met by a psychologist that just, took their time to understand more about the disease, but there's a lot that don't. And I think understanding and advocating for yourself and knowing that you're worth it all kind of spirals back to that depression, anxiety, and not always feeling like you are.
Well, like, I know, Kathy, you're really active and
Yes.
other people stay active, but you also understand that, like, let's say people living with multiple sclerosis or other chronic conditions may not be able to be active in the same types of ways.
Right.
People who don't live with those conditions are maybe.
Absolutely. And like you said, learning to do go slower. And I think if we've had it a long time and I'm still in relapsing remitting, but things are slowing down, I'll go to do something I did before and I'm like, why did that take so long? And so I think, that slowly happens and you don't notice it as much when it's that slow. Cause it's like, all of a sudden it's like, I can't do this. And I could. And so I do appreciate that. And I think there's an understanding on your end of what that means to us, where a lot of psychologists don't really understand the loss of whether it's physically, emotionally, or just cognitively, but you're able to help with that. And so next time, if you're up to it, I want to tackle some of the other issues, the insomnia, which is so huge for all of us. But I know in the MS world, it's something we talk about all the time, is just the fatigue and the not being able to go to sleep, the constant battle of that. And a couple of the other things that I know today we can only tackle two. We both are a little rushed today, but I'm so excited to have you on. I love the program that you're doing. That'll all be on the bottom of the show notes. I can't tell you how much we appreciate you and how much we appreciate the psychologists that are taking the time to get the extra credits, to go further and to learn more about mental health, about healthcare, about our autoimmune diseases. It means so much to us to have that out there. So I hope that this gets out to several of the patients that need that. And even though you're not available, but you do have some on your team, right?
Yep, I have a few folks on my team and more coming, hopefully.
Great. Perfect. Well, then we will go ahead for today and say goodbye today. And thank you for joining. And then we'll be back. So look forward to having Aviva Gaskill back on. And we will then be talking about some of the other issues we brought up. So have a great day. I hope that this meant something. Again, at the bottom of the show notes will be ways that you can connect with her. And thank you so much. It was a pleasure speaking with you.
It was a pleasure to speak with you too. Thanks, Kathy. Bye.
Bye-bye. Well, thank you so much for joining us today on Move It or Lose It podcast, where you can again find us every Tuesday and also wherever you like your podcast, whether it's Apple, Spotify, Stitcher. Join us on that. And we can't wait to see you again. We're going to have a lot of exciting guests and working together. And as always, you'll hear us say at the end of every podcast, we are stronger together. So let's do it. Let's become stronger together.